And as you can see, like lisinopril, glyceride, cytostatin, aspirin, and omeprazole, with an A1C of 9.1. And they're referred to me because their triglycerides are 26.20. Their HDL is 22. Their LDL-C is not calculable, and even if you could calculate it or measure directly, it's probably worthless. Why? Patients are going to be very discordant. It's going to have a very small LDL particle and a large particle number. So how are you going to fix those triglycerides? First of all, why are they high? Yeah, they're high because they have controlled diabetes. I won't go through the whole issue, but I will point to this right here. LPL, lipoprotein lipase. So lipoprotein lipase is an incredibly important molecule. It is what breaks down the big bulky molecules, VLDL, chylomicrons, and makes them smaller, IDL, LDL, VLDL. It is what makes those smaller. When you have type 2 diabetes, and you have the metabolic syndrome, you have insulin resistance, you downregulate the function of lipoprotein lipase. And because of that, your molecules all get stuck at that high level. So you can't make LDL, you can't make HDL. You just have VLDL and chylomicrons running around. Remember, lipids are about particles. The problem isn't that they have a lot of triglyceride. Well, that's a problem for the pancreas. They have a bunch of ApoB molecules that have chylomicrons and VLDL that are running around. They have these big molecules that can't be broken down. So you have to get the lipoprotein lipase to work better. Lipoprotein lipase, this is one patient that I want on a very low fat diet. I want him on a low saturated fat and low trans fat and low polyunsaturated fat and low monounsaturated fat diet. I'm on a truly low fat diet because fat is the substrate for lipoprotein lipase. So if your lipoprotein lipase doesn't work, I want you to have as few chylomicrons as possible. So eating less fat. And then you try to get lipoprotein lipase to work better. Weight loss, exercise, and a number of medications that you can use to get lipoprotein lipase to work better. Metformin, TZDs, fibers, omega-3s. Get that sugar down, the lipoprotein lipase will work. I just want to show you something interesting that happens though when you do that. So this patient, I was able to get this is an actual patient. I was able to get his lipoprotein, his triglycerides down to 320 by getting his A1C down to 7.3 in the right way. But look what happened to his LDL cholesterol. It went up. His LDL-C went up. His LDL-C, I told you it was an actual patient, so they couldn't measure it before. But I guarantee his LDL-C went up. His LDL-C went up. Why does LDL-C go up? Because his lipoprotein lipase is working, and now he's able to make LDL cholesterol. His total ApoB load probably didn't go up. We don't measure ApoB, but his total ApoB load didn't go up. His non-HDL didn't go up, so he's not probably more atherogenic. But his LDL cholesterol goes up. That happens in all these patients. I tell them it's a victory, especially because I know how to treat an elevated LDL. I treat an elevated LDL. So the statin, it's easy, right? So this is an easy problem to fix. Much more, the triglyceride HDL problem is much more